Hello, everybody, and welcome to this lunchtime webinar all about what are we talking about? Sorry. Uh,
Navigating antenatal appointments.
that's the one. I'm so sorry. It's been a really busy week. Thank you, everybody, for joining us for this webinar as part of Neurodivergent Birth Awareness Week. I've been having a lot of fun this week, and I hope you've managed to make it to some of our other webinars. But if you haven't, please do just check out our new YouTube channel because everything's on there, including this wonderful presentation that is about to happen today. So we're presenting all our webinars this week in that kind of style, webinar style. So if you have any questions as we go along or comments, thoughts, experiences to share, please pop them in the chat box and I will keep an eye on that. And then we'll have a bit of space at the end if you want to ask any questions, and I'll go through the questions in the chat as well. I'm absolutely delighted to have Erin here. Erin Fung is one of our ND birth training practitioners, which we're so grateful that she's part of the team now. And yeah, lots of other things, antenatal educator, podcaster, I would say social media star. But I'm really looking forward to listening to this session all about navigating antenatal appointments as a neurodivergent person. So I will hand over to Erin. Thank you.
Thank you for the lovely introduction. Hello, everybody. Nice to meet you all. So my name's Erin. I am a antenatal and hypnobirthing educator. I am autistic and have ADHD and was finally diagnosed with both this year, as well as having PMDD. Um, and I'm really passionate about obviously this topic, lived experience, as well as being really passionate about making sure that neurodivergent people who are pregnant are getting the experiences that they deserve. So I have got slides which I'm going to share. So bear with me while I find the right uh, window. Can everyone see the slides?
Yes, thanks, Erin.
Amazing. Okay. So today we're going to be talking about preparing for antenatal appointments as a neurodivergent person. Just before we start, just some housekeeping. You are free to have your cameras on or off. That's absolutely fine. Please do ask questions in the chat. No question is stupid. Feel free to move about, get up, do what you need to do, and feel free to take notes or screenshot anything that you think would be useful to be able to review later. So we are going to be looking at neurodiversity or neurodivergence as a pregnant person and navigating those antenatal appointments. And that can look like different things. Neurodivergence takes different forms. That could be autism, ADHD, Tourette's, dyslexia, sensory processing disorder, and it also covers lots of co-occurring conditions which can have an impact on pregnancy and birth, such as hypermobility, Ehlers-Danlos syndrome, endometriosis, and POTS. So when we're looking at why antenatal appointments are so challenging for a neurodivergent person, there's lots of different reasons why we might find these quite difficult. So things like sensory differences can make the environment really overwhelming. If you imagine bright lights, unfamiliar smells, loud noises, these can all quite heighten anxiety in somebody who might already have a nervous system that's in that sympathetic nervous system state and quite stressed and anxious already. We might have communication differences. So some people might find it difficult to express their needs or their understanding of medical jargon. They may be non-speaking, and that can really make those appointments quite difficult. We might have executive functioning difficulties with organisation, planning, and that can add another layer of stress and anxiety in navigating, getting from those appointments. Demand avoidance is also really common in neurodivergent people, as well as white coat syndrome and feeling quite anxious, and that kind of fawn trigger in the sympathetic nervous system, and then walking away and thinking, oh God, I didn't agree with that. Why didn't I say anything? But it's very difficult to advocate for yourself if you're feeling that out. We might have existing trauma, and as neurodivergent people, we know that a lot of us do carry trauma throughout our lives from our upbringing, from relationships, existing and previous interactions with healthcare providers. And then we may have misunderstandings about gender identity as well, which is an added layer of complication. So things to consider if you are neurodivergent and you are going to be going to antenatal appointments. I'm going to go through each category one by one. So first off, communication differences. So neurodivergent people may have different challenges and needs when it comes to communication. So we might have what we call auditory processing difficulties or differences. And for me personally, this looks like really struggling to retain information and process that, particularly if it's verbal. So if someone gave me verbal instructions, in fact, I can give you an example of this. When I went to my local hospital to do a review of the antenatal ward, I asked where the toilets were so I could go and see what the state of the toilets were for the review. And the midwife said, oh, go down the corridor, turn left, turn right. And I went, okay. And then I turned around and it went out of my head. And I was so embarrassed. I thought, I can't go back and go and ask again. She's going to think that I'm stupid. And this is what auditory processing can look like. For me, I have to have subtitles on when I'm watching telly. I can't just listen to the TV because although I don't have issues with my hearing, my brain just can't catch up with what's being said. So we might have difficulties retaining that information. Difficulty of eye contact can be quite common in neurodivergent people. And when you're speaking to somebody one-to-one in quite an intense environment, that can be really uncomfortable, as well as needing time to process that information because our brains may have a little delay in understanding what's being said and actually being able to process that. We might prefer written information. Like I said earlier, we might be non-speaking and use different devices to communicate. We might want an advocate with us. Sometimes we can shut down if we are really overwhelmed. So one of the tools that Neurodivergent Birth has is one of these communication passports, and these are all available on their website. And I would really recommend downloading those and taking these to your antenatal appointments to help you navigate these. Some of the requests that you might want to ask for if you do have communication considerations are if you do struggle with auditory processing, ask for more time to process that information. You can also record the audio of your appointment so you can listen back to the information, or you could run it through a transcription program so that you can read the information later. And I'm going to circle back to this in a minute because I know this is something that is quite tricky for some people to navigate. So I'll go into this a little bit more detail. If you struggle with information retention, again, asking for information in a written format and again, recording the information can be really, really helpful. If you struggle with eye contact, making sure that your care provider is aware of this in advance may help reduce misunderstandings. Sometimes we may really struggle with this if we're speaking one-to-one, face-to-face with somebody. So making sure that they're aware that you are listening and your mind isn't wandering, you are paying attention can be really important. So I'm just going to shift my screen one sec. There we go. So going back to recording the appointments, I know this is something that some people feel really uncomfortable doing. It can feel quite confrontational to say that you're going to record an appointment. However, it is an accommodation they legally should be allowing you to make if you feel like you need to record those appointments. It does explicitly state in the National Institute of Clinical Excellence guidelines, so the NICE guidelines, as well as the British Medical Association, that you can record your appointment. So if you are told that you can't, you can tell them the NICE guidelines explicitly state that you are allowed to record the audio as well as have an advocate with you at your appointments. If you get told it's a breach of data privacy or GDPR, this is not the case. And again, the BMA states this. It's your personal information. You are allowed to record and retain that information. You're not using it for any other purpose. You don't have to disclose that you are recording. You can covertly record, and that is perfectly legal. They can't refuse to let you record the appointment. And if the obstetrician or the midwife that you're speaking to or seeing isn't comfortable being recorded, they have to go and find a colleague to do your appointment. They can't refuse you care because of it. And it is a disability discrimination to refuse you reasonable adjustments. Like I said earlier, really good tip if you do record your appointments and you do struggle with auditory processing, and it's worth running that through a program or an app like Otter, which will transcribe it into written text so that you can read it back later. So just a few little things to reinforce what I've said. The British Medical Association says that information disclosed during a consultation is confidential to the patient, and covert recording is therefore not a breach of confidentiality. And also, doctors should not refuse to continue with the consultation unless the patient can be seen safe and in a timely fashion by another colleague who is willing to agree to the recording. Other considerations and requests with communication may be needing time to process that information. You do not have to make a decision in the moment. I know sometimes we can feel really pressured into making a decision, booking an induction or booking procedures in the moment. It is very, very rare, particularly at an antenatal appointment, that you have to make a decision while you're there. You can usually have time to think about it, either whether that's stepping out the room for 10 minutes and then making a decision, or going home, having a think, and then letting them know your decision at your next appointment. You are not under any obligation to say yes or no to anything without being given time to process and think about that information, and making sure that you've actually been given the information to make that decision in the first place. If you do prefer written information, ask them to give you copies of all the information that they have verbally relayed to you. And also, if you are autistic or you have ADHD and you feel overwhelmed and you may shut down, then it might be worth considering taking an advocate with you to help you communicate if you do feel overwhelmed and stop talking. If you are dyslexic, you may have communication preferences regarding written information. So again, you might prefer to record the audio so that you can listen to it later. Or you can ask if there are leaflets in accessible colours or fonts. Some people who may be non-speaking and may use augmentative and alternate communication devices, so AAC devices like picture systems or high-tech devices and visual aids with symbols and things. It's worth making sure that your care provider understands that that's the way that you prefer or need to communicate. And it doesn't necessarily equal an intellectual disability, because that can be a misunderstanding when it comes to using AAC devices. Next, we have sensory differences. So some neurodivergent people really have sensory differences. Either they could be sensory seeking or they can be sensory avoidant. A hospital environment can be very stressful for somebody, particularly with sensory avoidant, not preferences, but it can be quite stressful for them. There's quite a lot of extra information that needs to be processed. If you imagine a hospital environment with very bright fluorescent strip lighting that can be really bright and sensitive to your eyesight. There are lots of unfamiliar noises, particularly again in a maternity ward. You've got CTG machines beeping. You may hear people in different rooms in labour. That can all be quite overwhelming as well. You might have preferences around touch. Some people like touch, other people are really adverse to it. I am adverse, and if the kids touch my face, it sends me into a rage. They know not to touch my face, and my husband has learned not to gently stroke my arm because it makes me want to hit him in the face. We have different preferences around touch. You may have sensitivities around smells. Perfect example of this morning is my son, who is 6, definitely has a very sensitive sense of smell. And he went into the bathroom after my husband had used it and came running downstairs gagging. And I actually thought he was going to throw up his breakfast. But if you think about a hospital environment, it's full of really unfamiliar smells. You know, they may be serving lunch, and that can be really overwhelming on your smell senses. The smell of disinfectant can be really off-putting. It just doesn't smell like anywhere else that you may visit. So that's something to bear in mind. You may really dislike crowded places. You may also have preferences around products, such as some of the gels they put on your tummy for ultrasounds, plasters, even the gowns that they may ask you to wear if that's necessary. Again, the passport that neurodivergent birth have can be a really good way of just making sure that you're communicating what your sensory differences are. So I just want to play a little video. This is a short clip of an autistic person's experience of visiting a hospital. It's created by the University of Bristol. Just bearing in mind the trigger warning that some people may find this overwhelming. And if you do, please mute it so that you don't get overwhelmed. Oh, this is where I try and get it to play now. Bear with me. I can go get it. 3 hours. Do you need videos? Oh, no, I was not going to. So that just gives you a little idea of how overwhelming the hospital environment can be. So if you do have sensory differences, consider asking if you can wait somewhere more quiet and private instead of the busy waiting room. That may help you with that transition from being in the waiting room to going into your appointment. If you can, ask if you can have your antenatal appointments at home, and that means you avoid the hospital completely. And I know some people, if they're having home births, may have their antenatal appointments at home anyway, but it is an accommodation that they can make, so you can request that you have those appointments at home. Request midwives and doctors explain any procedures first and give you time to process that before they touch you. They should not be touching you without your consent anyway, but they can give you some extra time just to think about that before they do anything. And if they are doing an ultrasound scan, asking if you can apply the conductive gel yourself for your antenatal scans and wipe it off as quickly as possible once the scan is over. Next, we have executive functioning. And again, there is a passport for this if you wanted to take that to your appointments. Consider timing of appointments. You may prefer a morning appointment to prevent task paralysis and all day waiting for an appointment. And again, this is something that I really struggle with myself. If I have a call, actually, today's a good example because I knew I had this at midday. I really struggled with doing anything this morning because I was really conscious of missing it or forgetting or being late. So I didn't do very much this morning. And it's a really common thing with neurodivergent individuals that you just go into waiting mode if you know you've got an appointment. That just kind of puts your whole day out of kilter. So asking for a morning appointment and getting them done in the morning means that you are free to carry on with your day afterwards and you're not in waiting mode. Ask the trust if they send reminder texts and emails to prevent missing appointments. And again, as an ADHD person, I am really, really bad at double booking myself or forgetting appointments. And I am very, very good at putting things into my calendar and very, very bad at checking my calendar in the morning. And I miss appointments all the time. I have 3 children. They have multiple hospital appointments. And if it wasn't for Kings texting me beforehand, I would miss appointments. So it can be really handy if they are sending you text messages as a reminder. Ask for printed copies of any research, evidence, or guidelines so you can take them home to read rather than making rush decisions due to decision paralysis and white coat syndrome. So we can sometimes feel really under pressure to make those decisions in the moment, like I said earlier. And actually, I think this applies to anybody, to be honest, not even somebody that is neurodivergent. We should be given time to process that information and to make those decisions in a way that gives us time to process and think about our options. It's really common for people who are neurodivergent to also struggle with anxiety. And there are a few accommodations that they can make for you if you are particularly anxious or struggle with anxiety. Continuity of carer is something that you can request, and that means that you see the same midwife or same midwifery team for all your appointments. I know at my local hospital, they do have a team for people who may need that continuity. And there is a small group of midwives who handle all the antenatal appointments and will try their best to be there at the birth. And we do know that for anybody, regardless of neurodivergence or not, we do have better outcomes when we have continuity of carer. You have that familiarity with the person that you're dealing with and is attending your birth. And that really improves outcomes and makes the person feel much more relaxed and comfortable. Again, considering asking for home appointments to avoid having to travel to unfamiliar places. As a neurodivergent person, I really struggle with visiting places that I have not been before. I will overplan and I will put in contingency on top of contingency time because I am terrified of being late for anything. I will plan where I'm going to park. And then I get stressed if there's no parking. So I will often just bail out of things completely if it is too unfamiliar, the journey is too stressful. So asking for at-home appointments can be a really, really good idea. And we know that lots of hospital car parks, it's very hard to find parking at hospital car parks. So if you are going to the hospital, looking at other places in the local area where you can park is a really, really good idea, just in case there is no space at the hospital. And I would say leaving extra early so that if you are driving around, you're not getting hot and sweaty and stressed trying to find a parking space. I would also strongly recommend bringing a friend or a family member or an advocate with you to your antenatal appointments. So that could be your partner, that could be a friend, or it could be hiring a doula. So a doula is a non-medically trained birth advocate or birth support person. People generally try and book them for the birth, but they can go to your antenatal appointments as well. And having that extra person there has a huge raft of benefits. I really struggle with medical appointments myself. And I had a medical appointment not that long ago. And I went in with my list of things that I was going to cover, and I got completely flapped and flustered. And then when I got back in the car with my prescription, I thought, oh, hold on a minute. there was a whole thing that I wanted to cover that we didn't even mention, and it's because you just get flustered. My friend did offer to go with me, but unfortunately she couldn't make it. But she would have been there with the list, and she probably would have gone, "Oh, excuse me, you haven't covered this, addressed this issue." So having somebody with you can be really, really helpful, and that can lessen the anxiety as well. So if you want to look up doulas, I would recommend lots of different doula directories. So we can circulate that list afterwards. But look for somebody that's local to you or familiar with your hospital, because they probably will have attended births in that hospital or that trust, and that will add an extra level of familiarity for that advocate for you. And then finally, just a little bit on your rights and advocacy. As a neurodivergent person, we can really struggle with advocating for ourselves for all of the reasons that I have just covered. And it's really important to understand that you do have rights, you have legal rights. And sometimes, or quite often, when we're pregnant, we feel like those just go out the window, but they still apply. You are allowed to do whatever you want. Okay, if you are told you are not allowed to do something or you have to do something that is factually incorrect, what they mean is that they would recommend you do something or they would not recommend that you do something. It does not mean that you have to do what you are being told. If you feel like that's not the right decision for you or your baby, then you are within your rights to disagree and do something different. The guidelines and the policies in the hospital are just that. They are guidelines. They are not legally enforceable. You do not have to adhere to them if you don't want to. I'm not saying be really contrary and just do the opposite of what you're being told, but you are allowed to say no to anything that is being recommended. If you're classed as high risk, you have the right to ask why. It is not, well, the hospital may make it seem like a tick box exercise. If you have risk factors, they should be telling you what those risk factors are, what the evidence is behind those risk factors, and then they should be putting an individualized care plan together so that you can achieve the kind of birth that you want within the realms of safety. You have the right to access your maternity notes for free. And that can be really good to do after your birth, particularly if birth goes off course, off your ideal course, or things happen and you would need to understand why. And that can be really helpful to process the birth afterwards. You have the right to decline anything in labour. That doesn't matter what it is. No one's allowed to put hands on you or in you or anywhere near you unless you say yes. If you say no, it's not negotiable. No is no. You do not lose bodily autonomy just because you are pregnant or giving birth. You have the right to birth at home or anywhere else, regardless of whether they recommend it or not. Legally, you are allowed to birth at home. They may not support it, but it is your choice. And the NHS has to make reasonable adjustments so that people with disabilities can access the same maternity care as any other person. So everything that I have said today are reasonable adjustments that the NHS should make to accommodate you to be able to navigate and attend those appointments in a safe manner. I have flown through all of my slides far quicker than I thought I was going to. I hope that was helpful. And I'm sure there's some questions if
Thank you, Erin. Thank you so much. I'm going to do my usual like waffle bit and share all my buzzy thoughts whilst people are, if you have any questions, kind of framing them before you raise your hand, or you're very welcome to put in the chat as well. Thank you so much. I think this is such an important session because often, our antenatal care is the beginning of our journey, isn't it? In terms of how safe we feel and how listened to and validated we feel as neurodivergent pregnant people. So I think it's really important to talk about this and to kind of get this right, because it really sets the tone for the rest of our perinatal journey. I really love your emphasis on like time to process, because I think, all of us who have had babies and attended maternity appointments probably felt that kind of pressure in the moment, like to make a decision. But yeah, please ask for time to process. We all need time, particularly at this time of life, to think about things and to discuss things and for stuff to kind of percolate as well. On the sensory side of things, it's really interesting to me how different how autonomy can be really important here. So although things like the cold jelly of an ultrasound scan might feel really difficult, but actually if you're the person applying the cold jelly and removing it yourself, doesn't that often just lessen the discomfort? And I think that's really interesting. Um, Erin mentioned doulas. Of course, we're massive fans of doula care, and we do have a doula directory of our own, which technically is searchable by postcode, but it's a bit clunky. It's not, it's free to register and we don't kind of plow any money into it. So we've tried our best, but the other way to access a doula who is trained in supporting neurodivergent people or who's neurodivergent themselves. Another way to access them would be to drop us an email and we will help you to kind of find one in your locality. And then finally, the rights piece is just so important. And if reasonable adjustments are your jam, please come to our session this afternoon at 2 o'clock with Beth Russell, who's another one of our practitioners, as she talks all about reasonable adjustments as legal requirements and not luxuries. So there's my little plug for this afternoon. I'm just looking at the chat, Erin. Teresa Ann says, good antenatal care can be the difference between birth trauma and not. Yeah,
Mm.
absolutely. So
I,
powerful.
I think a lot of people who are neurodivergent can end up quite traumatized by their experience because accommodations are not made, or they may not even realize the impact of the birth environment on them. So I think having our own awareness is really, really important, and pre-planning into that, and then making sure that your team around you are aware as well as your birth partner and birth support people as well.
Yeah, absolutely. Yeah, Lisa's given that the double exclamation mark. And Lisa says, Erin, this was very helpful to confirm some things and reinforce others with resources. Most of all, thought-provoking and awareness of things overlooked. Thank you, Erin. Yeah, absolutely. Couldn't agree more. And earlier on, Teresa Ann said that she loved your housekeeping at the beginning because it gave everyone permission to move about, and that's very neurodivergent friendly. And yeah, it's so important, isn't it? And I think this makes me think about, we're talking about antenatal appointments today, but it makes me think about accessible antenatal education as well, which is such an important part of this time, and how accessible it is. Are we allowing people to be in those spaces exactly as they need to be, and just having that little mention at the beginning, if you're somebody who does antenatal education, having that little invitation to be here exactly as you need to be makes all the difference. And Teresa Ann also said, I think it was when we were looking at the sensory infograph, that she's used it with a client, and the client was overwhelmed with happiness and felt so seen by this discussion and awesome infograph. Thank you so much. Does anyone have a verbal question or? Oh, Joe.
Hi,
Of
hi,
course.
Erin. Thank you so much for this session. It was brilliant. You covered so much really rich, important things. My question would be, let's say I'd come to this session and found it incredibly validating and really felt that my needs had been spelt out by you. And then what tips or recommendations would you give if I then went to speak to friends and family and said, oh, I think I'm going to ask for this, and I'm going to make a note of doing this, and I'm going to try and record my appointments, and they were dismissive and said, oh, don't be silly. The NHS is under so much pressure. You can't be, you're not just one person. You can't be expected to ask for those things. You're making a fuss. So what would you say to someone in that position?
It's really hard, isn't it? Because they should be your cheerleaders and not the opposite. Um, personally, I would probably be giving them some information. I might actually send them the recording of this so that they can understand why it's so important. Um, there's lots of podcasts and things out there as well that you can send people, but I just think having a really honest conversation with the people around you of the impact of some of these things and how small these adjustments are and the huge impact and difference that can make on your experience, hopefully that they would be supportive of it. because you're not asking for the world to be able to record an appointment or ask for, anything else that I've covered. But I probably would send them the recording of this session just to help them understand why it's so important.
That's really helpful, Erin. Thank you. I
Yeah.
hope this goes far and wide when people are
Yeah.
watching it.
I even thinking of that slide in particular, Erin, where when you quote the NICE guidance and the what the BMA say on this, I think a screenshot of that to share would be super useful because that people can go and verify that from the original source, and it's really powerful actually.
Yeah, I actually do have on my website, on my blog,
Yes.
there is a link somewhere, one of the blog posts somewhere on recording your appointments, and it does have the screenshots of NICE guidelines and the British Medical Association
Amazing.
guidance, so they can just get that up and show it if they need to.
So if we go to your blog, Erin, I'm gonna see if I can paste it in the chat now.
Mhm.
Um, we should be able to find that particular entry with those
Yeah,
screenshots on.
yeah. If you search for recording your appointments, it should come up in the blog search.
Amazing. And Kelly has just really Kelly's comment is exactly what we're talking about here. Kelly said, oh, sorry. I've lost my space. I mostly just want to say that I like that you stress that these are reasonable requests. I'm a people pleaser, so usually I do not say something, and it's hard. It takes, particularly if you've spent a long time people pleasing, as many of us have, it takes a lot to kind of push yourself towards a little bit of discomfort and ask for what you really need. But hopefully, sessions like this really validate that, yeah, this is legally supported. And as Erin said, we're not asking for the whole system to be overturned to accommodate you as much as, you are worthy of that. And, lots of things in maternity services are being looked at the moment. But we're just asking for really quite simple changes that make big differences. So
Yeah.
thank you for that comment.
I
I
do
think
think.
I will have to go on a little journey to find the blog,
Oh, I'll
Erin.
look for it in a sec for you.
Okay,
I was
thank
I was
you.
just going to say that um I do really, really believe having an advocate with you at these appointments can be really, really important. I am hugely vocal about all of these things and really personally struggle implementing any of it
Yes.
myself. So I completely understand. And my last GP appointment, I went to go and see them about my PMDD, and I was going to type out everything that I wanted to say and not say anything and just hand him what I needed to say because I knew I was going to get flustered and then didn't do it because I talked myself out of it. And because I knew that I wouldn't have somebody with me at that appointment. And now I really wish that I had just done what I planned to do. So I think pushing yourself a little bit and either making sure that you accommodate yourself or you bring an advocate with you to appointments if you think
Yeah.
you're going to struggle can be really, really important.
Yeah, thank you for that because I mean I personally I because my husband couldn't come to any antenatal appointments, I just went by myself. I thought, well, he can't come, so and I suppose I looked at it from the point of view of like, well, he can't be part of that bit, so it'll just be me. But actually I really would have benefited from having somebody else there. It could have been anyone. Does it well, not anyone off the street, but somebody that a trusted person. It doesn't necessarily have to be the person you're co-parenting with. So thank you for that reminder because that's really important. I have found the blog post, so I've just posted that into the chat. Erin's Better Birth blog, and this one is my doctor says I can't record my appointment. So do take that with you, Kelly, if you think that might be helpful. Lisa says you would think that medical staff have built-in trainings on how to support their patients who are neurodivergent. Do you find that medical professionals are doing the work in continued education to be more aware and supportive, and or doctors in your local area are receptive and supported, where you can see change and awareness happening? I've got
Um,
lots of thoughts, Erin. What do you
yeah, I know
think?
you do. I will say from speaking on behalf of my local trust, which is King's, and that's the hospital that I used to chair the maternity and neonatal voices partnership for. They are setting up a neurodivergent and autistic focus group. So they are aware. However, I would say on an individual level, because that's kind of high level, isn't it? The kind of headed midwifery and the director kind of looking at how to support that group of people. On an individual level, it's patchy at
Yeah.
best. it depends on who you see. But Victoria,
Yeah.
you've probably got lots to say
Yeah,
about.
no, I mean, we really, Lisa, that's why we exist as an organization because we recognize this gap in awareness and in training in particular. And yeah, we're starting to see some kind of change. And I think the momentum is gathering in terms of recognizing how important this is. And Awareness Week has actually been, it's far exceeded our, I suppose, expectations in terms of numbers of trusts who've engaged with it, numbers of medical professionals who are as we speak, hosting events, talking about it. There's tea trolleys going around with resource packs and biscuits. And so the conversations are starting to happen, which is really important. I think up till now, it's relied on passionate individuals, probably like lots of people on this call, who within their trusts have gone out there and said, we need to be looking at this. And people have been doing things on an individual basis. So we're really keen to support professionals to deliver this support to their service users because the law says that you should be doing it, but we're not helping you to do it without awareness training. So we're really keen on that changing. Great question, Lisa. And Simone says, I always take my iPad. Oh, I always take my iPad and hand my iPad with notes to the consultant, as I often leave not getting my full message across. Being dyslexic, I carry my iPad most places as I hate writing things down. That is a great tip. Valentina says, amazing session. Thank you so much. And Lisa, wonderful. Thank you. And Claire, you've got your hand up.
Hello.
Hello.
Yes, firstly, thank you very much. I'm currently 16 weeks pregnant. I've had a couple of antenatal appointments so far, but I'm also a healthcare professional, and it is very limited as to the training that we get,
Yeah.
absolutely. And there's things in here that I think I knew that was probably the case, but I didn't know exactly where to find the legislation on it or things like that. Um, And I also, obviously, as a neurodivergent person, somebody kind of recording my sessions and things would make me worry myself.
Mm-hmm.
So I guess if you feel able to explain what you're doing, because actually you do, often you can tell whether the professional you're working with is a bit like you or not. But yeah, that again, there's that sort of PMDD and that thinking of, oh God, have I done something wrong and whatever there might be there. But I've had advocates in sessions, and obviously the more, I've been an occupational therapist for 15 years. So the longer you get through, actually, the more you are comfortable with, this person is there for a reason and how to kind of involve and engage them in a session the same way as you would an interpreter or something like that. So yeah, I think just we don't get taught enough. And as you say, individually we try and we
Mm,
try and change things and we try and put things in. But the training that you have, the same as, as every other kind of workplace is never enough.
yeah.
So it's brilliant to have this stuff. And yeah, I kind of want to share it with all my team and stuff like that as well. So just basically thank you, really.
Thank you. Thank you for sharing that and thank you for yeah, sharing the perspective of the professional as well. I really think, we always want the sessions that we have to be respectful of both kind of sides of the conversation. And we really, really appreciate that a lot of people working as health professionals are themselves neurodivergent. And if we think about all the things we talk about at neurodivergent birth, the sensory overwhelm, the communication challenges sometimes, etc., it
Mm,
applies to so many of us as professionals as well. So it's so important that we're taking care of everybody's needs in these spaces and kind of not just assuming that everyone feels and goes through these appointments and things in the same way. So thank you for highlighting that.
absolutely.
Erin, have you got any thoughts on what Claire said?
Yeah, I think I acknowledge that it can be uncomfortable as a healthcare provider to be recorded, and I think communicating to the healthcare provider that you're doing that as a tool to help you process and understand information, and you're not doing it to try and catch them out,
Yeah.
because that's not the purpose, I think is really, really important. Um, and also that they can decline, they just need to find somebody else to do the
Yeah.
appointment if they genuinely aren't comfortable with it.
Yeah, that's a really good point. I think, yeah, it must be. I can imagine being in any professional situation and being recorded immediately, even in this session, it immediately kind of gets the adrenaline going a bit and it can feel uncomfortable, but really understanding that the underlying need is important, isn't it? And it's not about catching people out. It's an accessibility request. Yeah. Thank you so much. Simone says, really great session. Definitely will be taking the points into my doula and antenatal role. Thank you, Simone. So thank you everybody for coming. If you think it has been a useful session and you'd like to share it with your colleagues, please just head to YouTube at Neurodivergent Birth, where we're uploading this shortly. And yeah, thank you so much for your time this afternoon. And thank you, Erin, for hosting.
Thank you for having me.
Take care, everybody. Bye-bye.
Thank you, Erin. Bye.
Bye.